There's multiple ways of applying stem cells generally. You often see it done either locally or intravenous. And so what benefits can you expect to see from each one, or how do you decide which you're going to do in a certain application?
So this is based on a personalized protocol. Not every patient needs the same amount of stem cells or the same way of applying them. Per se, let's say that we're talking about an articulation. An articular capsule, beer articulation, is a closed space. It has its own environment, we can say.
It's like inside a joint for somebody who doesn't know what articulation is.
Yeah, like it's inside a joint. So we want to directly stimulate that joint that is having cartilage waste, and it's giving a lot of pain. So we want to direct the therapy to that specific environment. And not only systemically. Systemically would be the full body's response. And stem cells, as they naturally take care of repairing and maintaining our body, stem cells have affinity for the signals of damage. That's called cellular migration, right? So they have like these antennas on their surface that detect the signal of damage and stick to it, and then start to do their job. So when we are doing a systemic application, and we're talking about IV, we're addressing lots of tissues in our body. When we want to get to a specific organ, we do it that way. When if it's an advanced stage disease, maybe we can even do it through a catheter, intra-arterial, and deliver the stem cells directly to that organ.
Wow.
And it has shown great benefits. And what we do is that we make basically a shortcut for the stem cells to interact where they're mostly needed. Musculoskeletal injuries, bones, muscles. Well, the direct application would act in a higher pace or in a faster pace in that particular tissue.
A higher concentration for the local tissue.
Correct. So if we applied IV, part of the stem cells would go to other sites of your body that are also expressing damage. Of course, that they have affinity for the tissues that highly express more of those signals, and also synergize with IV therapy. I always give it the sense or the example that it's a stimulation from the outside in and from the inside out. We're locally stimulating your articulations to get better, because that's a chronic, or we can say a pro-inflammatory environment, a nocive environment for the knee. And through stem cell signaling, we're improving that. But also the systemic stimulation makes that response even faster.